Hi guys, it's me, Professor D, and welcome back to my channel. If you have not done so already, please be sure to press that like and subscribe button below. That's what keeps the videos and content coming. On this video, I'd like to cover psych patients, mental health priority patients, and go over questions on which types of psych patients are going to be priority, which situations will be priority. So let's just jump right into it. Question number 1. The nurse in the outpatient psychiatric unit is returning phone calls. Which client should the psychiatric nurse call first? 1. The female client diagnosed with histrionic personality disorder who needs to talk to the nurse about something very important. 2. The client diagnosed with schizophrenia who's hearing voices telling him to hurt his mother. 3. The male client diagnosed with major depression whose wife called and said he was talking about killing himself. 4. The client diagnosed with bipolar disorder who's manic and has not slept for the past 2 days. Now I'll give you a moment to think of your answer. Okay guys, so the correct answer is 3. That patient that's hearing voices to harm his mother. So let me explain this to you, because I know you guys, a lot of you students, you saw suicide and you wanted to jump right on it. So I'm going to explain to you why suicide, that one was not the answer, but let's talk about the correct answer first. Let me explain something to you. When it comes to psych, and these patients are hearing voices to do something, that's what is known as command hallucinations. And when these patients are hearing these voices commanding them to hurt themselves or commanding them to hurt someone else, they have no choice. They are compelled to do whatever the voices are telling them to do. That's why that is the patient you're going to run to. Patient that's having command hallucinations, those voices are telling them to hurt themselves or others, that patient or whoever's around them is in imminent danger. And that's who you need to be running to, okay? Let me tell you why the suicide patient was not the answer, because the students, I know you guys see suicide and you want to jump on it, excuse me. Let me explain this to you. The patient was talking about wanting to commit suicide. This is a priority patient. This patient needs to be assessed. You're going to have to assess them, ask questions. But here's why they don't take priority. Because they're talking about it. They're getting their feelings out, saying what they want to do. Okay? So I'm not saying they're not a priority. You're not going to run to them. They're very important. But that patient who is having command hallucinations is in more danger. They're in immediate danger right now, right? Because the command hallucinations, they feel compelled to do it right now versus that patient that's expressing their feelings about their thoughts, okay? Number 2, the nurse is caring for children in the psych unit. Which client requires immediate intervention by the psychiatric nurse? 1, the 10-year-old diagnosed with oppositional defiant disorder who refuses to follow directions of the mental health worker. 2, the 5-year-old diagnosed with pervasive developmental disorder who refuses to talk to the nurse and will not make eye contact. 3, the 7-year-old child diagnosed with conduct disorder who's throwing furniture against the wall in the day room. Or 4, the 8-year-old mentally retarded child who's sitting on the playground and eating dirt and sand. And I'll give you a moment to think of your answer. Now, the correct answer, guys, is 3. And the reason 3 is the same answer is the same reason why when we were doing number 1, it was the same answer. We're worried about immediate harm, immediate danger. And that 7-year-old that's throwing furniture is in immediate harm of harming themselves and other children. So that's why you're running to them first, because they are in immediate danger. That's why they take priority over the other situations. Number 3, the male client diagnosed with major depressions returning to the psych unit from a weekend pass with family. Which intervention should the nurse implement first? 1, ask the wife for her opinion of how the visit went. 2, determine whether the client took his medication. 3, check the client for his opinion of how the visit went. Or 4, check the client for sharp or dangerous objects. And the correct answer is 4, check the client for sharp or immediate objects. Why is that a priority? Because that will place the client and others in immediate danger. Are you guys starting to see a theme here? We're caring about immediate danger. Immediate danger always takes priority. So the patient's feelings, the spouse's feelings, whether they took medication, all of that, we can worry about that later. But right now we're worrying about immediate danger, and that's why we're concerned about the sharp objects, okay? Next question. Number 4. The client on the psych unit is yelling at other clients, throwing furniture, and threatening the staff members. The charge nurse determines that the client is at imminent risk for harming the staff and clients and instructs the staff to place the client in seclusion. Which intervention should the charge nurse implement first? 1. Document the client's behavior in the nurse's notes. 2. Instruct the mental health worker to clean up the day room area. 3. Obtain a restraint or seclusion order from the doctor. Or 4. Ensure that none of the other clients were injured. And I'll give you a moment to think of your answer. And the correct answer is 3, guys. Obtain restraint seclusion order from the doctor. So let me explain to you how this works. And this is a concept that you're going to see throughout Psych, so you guys have to understand this. So if a client starts to escalate and they seem to be in an imminent danger of hurting themselves or someone else, you're not going to move everybody else out of the day room. You're not going to move everybody else from that area. You're going to move the client. Okay, you're going to move the client. You're either going to take them to an open garden or you might take them to a closed room, but you're going to remove them from everyone else. Guess what? You need a doctor's order for putting a patient in seclusion restraint. So you're going to make sure that you cover yourself with that order. Okay. Here's the reason why we did not choose 4 to check other people for injuries. It said that they were in imminent danger. No one has been hit. No one has been hurt. So the first thing you're going to do is make sure that you get that patient away from everyone else and you make sure you get an order. Now, speaking of that, guys, when a patient is escalating, their behavior is getting worse and worse, we always go from least invasive to most invasive. So this is what we try our best to do. We always want to remove the patient from the stimulus, okay? So if the patient was hanging out with other patients in the day room, we don't remove everyone else, we remove that patient and we take them out to an open garden. We take them for a walk. That doesn't work. They're still escalating. Then we take them to a room with the door open to get them to calm down. That doesn't work. Then we have to close that door and we might have to put restraints on, but we might just restrain the hands so they don't hurt themselves. Then we might have to restrain the hands and the feet. So do you see the concept? So we're going from least invasive to most invasive. But whenever you're putting a patient in restraint, you absolutely must have a doctor's order, and the physician must assess the patient within 24 hours to renew the order, or the order's dead. So when you get an order for restraints, it doesn't last forever. It's good for 24 hours. And the physician has to see that patient to renew it, or the order's not good anymore. Speaking of restraints, and the reason I'm going on and on about this is because so many test questions come from the subject. So I want to make sure that you guys are catching all of this, because I promise you're going to see it again. When it comes to restraints, as a nurse, guys, you absolutely must offer the patient toileting privileges. Like, they need to be able to relieve themselves. You have to offer them food. You have to offer them water, and you have to let them know what is expected of them to come out of the restraint. So they just can't be restrained just because they were being annoying. If they're being restrained because they're being dangerous, they have to know, okay, you're being dangerous, you are throwing things, and in order to get out of the restraint, you have to calm down. Okay? And so you not only have to do that, you have to document. You have to document how often you offered food, you offered water, you offered the restroom, and how often you reminded the patient of what the patient has to do in order to get out of the restraints. Legally, you must do that as a nurse, okay? Let's move on to the next question. Number 5, the woman comes to emergency department and tells the triage nurse she was raped by 2 men. The woman is crying and disheveled. She has bruises on her face. Which action should the triage nurse implement first? 1, ask the client whether she wants the police department notified. 2, notify sexual assault nurse examiner to see the client. 3, request an ED nurse to take the client to a room and assess for injuries. 4, assist the client to complete the emergency department admissions form. And I'll give you a moment to think of your answer. The correct answer is 3. You're going to have a nurse go check that client for physical injuries, okay? What we care about is imminent, okay? What's going on with them right now? Physiological integrity, blood pressure. Is that patient stable? Heart rate, respiration. Are they breathing? Are they bleeding anywhere, right? So we care about physiological integrity because at the end of the day, guys, who cares about documentation if you have a patient that's bleeding out and you didn't know they were bleeding out because you didn't assess them, okay? So the first thing you're gonna do is assessment. You're gonna check their body and make sure that they're stable. Next question. The nurse is working in an outpatient mental health clinic and returning phone calls. Which client should the psychiatric nurse call first? 1, the client diagnosed with agoraphobia who's calling to cancel the clinic appointment. 2, the client diagnosed with somatoform disorder who has numbness in both legs. 3, the client diagnosed with hypochondriasis who's afraid she may have breast cancer. Or 4, the client diagnosed with post-traumatic stress disorder who's threatening his wife. And I'll give you a moment to think of your answer. And the correct answer is 4. That patient that has PTSD and they're threatening to harm their wife. The wife is in imminent danger, okay? So that's going to take priority. That wife, she's in trouble right now, okay? That patient's threatening to harm the wife. That patient, that situation takes precedence over the others. Let's look at the others, guys. So you have 1, the patient who has agoraphobia and they're canceling an appointment. Well, that's part of their disease process. They're scared to be out in public, so they're canceling their appointment. That's not good. We're going to address it, but it's not priority because nobody's safety is at risk right now. 2, client has somatoform disorder and they're having numbness in both legs. Well, that's part of the disease process. Patients who have somatoform disorder, what's happening is they have a stress or there's something going on with their life mentally, right? But it manifests physically. So they might be stressed about a child that, you know, their child, but the kid's really 18, about to go to college, and they're stressed about their kid going to college, and they have a stomach ache, right? So somatoform disorder is when a patient has a psychological issue, you know, whether it's stress, anxiety, fear, but it's manifesting as a physical ailment. So number 2 is very important. We're going to want to address it, but that person's not in immediate danger. That's why they're not the priority. Then you have 3, where were we? Then you have 3, the client with hypochondriasis. They're afraid they have breast cancer. Well, that's what hypochondriacs do. You know, they always think that they have different diseases. So this falls in line with that disorder. Yes, we want to address it, but that patient's not in immediate danger. The only one out of these 4 who are in immediate danger is the one threatening to kill his wife, okay? And so that's why number 4 is the correct answer. Moving on, next question. The psychiatric nurse is working in an outpatient mental health clinic. Which client should the nurse intervene with first? 1, the client who had a baby 2 months ago and who's sitting alone and looks dejected. 2, the client whose wife just died and who wants to go to heaven to be with her. 3, the client whose mother brought her to the clinic because the mother thinks she's anorexic. Or 4, the client who's rocking compulsively back and forth in the chair by the window. And I'll give you a moment to think of your answer. Okay, guys, and the correct answer is 2. I've done this question many times with students, and many students tend to want to choose 4, the patient who's rocking back and forth next to a window. And I know what you guys thinking. You're like, okay, what if that patient jumps out the window? Here's the thing. All it said was the patient's rocking back and forth next to a window. We don't know if the patient's on the 1st floor, the 2nd floor, the 3rd floor. All it said was they're rocking back and forth next to a window. You are not Daniel Steele. Don't write your own story, okay? When you're given a question, you're given enough information to be able to answer that question, okay? So the person who's in immediate danger is the one whose spouse died and they want to join the spouse, What does that mean? They want to kill themselves. That's who's in immediate danger, okay? Next question. The emergency department nurse is assessing a female client who has a laceration on the forehead and a black eye. The nurse asks the man who is with the client to please leave the room. The man refuses to leave the room. What action should the nurse take first? 1, tell the man that the client needs to go for an x-ray. 2, notify hospital security and have the man removed from the room. 3, explain that the man must leave the room while the nurse checks the client. Or 4, give the client a brochure with information about a women's shelter. And I'll give you a moment to think of your answer. The correct answer is 1, you lie. And guys, I'm sure there has to be, but I can't think of any situations. But when it comes to abuse, that's the only situation I can think of in nursing. You are encouraged and expected to lie through your teeth. Do whatever you have to do to get your patient away from the person you suspect is abusing her, okay? So what you do is you lie. You say, oh, the patient has to go for a diagnostic test and no one's allowed. Or, oh, we have to go do a physical assessment and no one's allowed in there. Whatever you have to say, you lie to get that patient away from their abuser. Why? Because when that abuser is still standing there, you can't ask that patient any questions. She's not going to tell you the truth. Her abuser's standing right next to her, okay? When you lie to get your patient away from the abuser, make sure you leave the cell phone at the nursing station or even with the abuser, because here's what the abusers do. They tell the patient, put the phone on speaker so I can hear everything being said. And you need private time with that patient. So you're gonna lie to abuser, separate the abuser from the patient so you can talk to the patient. And when it comes to abuse, you don't beat around the bush. Once you are alone with that patient, you ask them directly, are you being harmed? Is anybody hurting you? Is he hurting you? Okay. What happens is a lot of these patients who are being abused, they want to tell somebody. Just like suicide. People who are suicidal, they want to tell somebody. Same thing like abuse. They want to tell somebody, but no one's ever come directly and asked them, are you being abused? Is anybody harming you? Is this person harming you? Okay. So you ask them directly. And if they lie, they say no, and they make up a story, that's fine. What you do is you give them information on the women's shelter and you give her tips for when she's ready to get away. What are those tips? And the reason I'm going into this is because a lot of psych questions cover this subject as well. So I might as well give them to you now, okay? What do you teach the woman? You teach her to pack an overnight bag and store it somewhere safe where her abuser can't find it. You give her the number or card to the women's shelter. You have her put important documents somewhere safe in that overnight bag, such as birth certificate, passport, money. If she can possibly have it at a neighbor's house, that would be great, okay? And you don't put any pressure on her. You let her know that you're available anytime if she changes her mind to come back, okay? Because that woman, she may not be ready today, but she may be ready tomorrow, and she needs to feel like she has an open door. So to answer the question, the answer was number 1, you're gonna lie and say the patient has to go to an x-ray, and you're doing that simply to get the patient away from their abuser. When it comes to abuse, you are absolutely allowed to lie through your teeth to get that patient away from their abuser. Next question. The charge nurse received laboratory data for clients in the psych unit. Which client data warrants a notification by the psychiatric healthcare provider? 1, the client on lithium whose serum level is 1.0. 2, the client on clozapine whose WBCs are 13. 3, 13 as in 13,000 guys. 3, the client on Xanax whose potassium is 3.7. 4, the client on Seroquel whose glucose level is 128. And I'll give you a moment to think of your answer. And the correct answer, guys, is 2, that patient that's on clozapine and the WBCs are 13,000. Your regular range for WBCs is 5 to 10,000. okay? So with that WBC being elevated, the first thing that needs to be going through your mind, especially with this psych medication, is what? Agranulocytosis, okay? And you have to report that to the doctor immediately. Let's look at our other choices. 1, that patient who's taking lithium and their level's 1. Well, you need to know your regular lithium level as well. Regular lithium level is 0.6 to 1.2, right? So this patient's lithium level 1 is within normal limits. Lithium level, the normal lithium level is 0.6 to 1.2. The patient is toxic. They reach lithium toxicity once they hit 1.5, okay? But for this question, the patient's at 1, so they're fine. Your choice of number 3, the potassium 3.7. That's fine. The normal potassium range is 3.5 to 5. You need to know this, guys. So that patient's fine. And then the last choice, the Seroquel patient who their blood sugar is 128. 128 is slightly elevated, but that does not put that patient in any immediate harm. But that WBC of 13,000, it sure does, because we're suspecting agranulocytosis, and that has to be reported immediately. Next question. The client diagnosed with panic attack disorder in the busy day room of a psychiatric unit becomes anxious, starts to hyperventilate and tremble, and is diaphoretic. What intervention should the nurse implement first? 1, administer the benzodiazepine Xanax. 2, discuss what caused the client to have a panic attack. 3, escort the client from the day room to a quiet area. Or 4, instruct the unlicensed assistive personnel to take the client's vital sign. And the correct answer, like I told you guys before, what are you going to do? You're going to move them away from the other patients. That is the first thing to do. You can't ask that patient what they're feeling or what they're thinking while they're having a panic attack. You have to remove them from the stimulus. Okay, this patient's having a panic attack. They're not going to be able to answer any questions for you while they're panicking. Okay, so the first thing you're going to do is remove that patient from the stimulus. Bring them to a quiet place so they can start to calm down. When they calm down, you can ask them how they're feeling. You can take their blood pressure. You can do everything else, but you cannot do anything for that patient until you remove them from that stimulus and bring them to a quiet place for them to calm down. Okay. Next question. The client diagnosed with somatization disorder is complaining of vomiting, having diarrhea, and having a fever. What intervention should the nurse implement first? 1, assess the client's anxiety level on a scale of 1 to 10. 2, check their vital signs. 3, discuss problem-solving techniques. Or 4, notify the healthcare provider. And the first thing you guys are going to do is check that patient's vital signs, right? Let's look at our other choices. 1 said assess their anxiety. That's a great answer, but that doesn't take priority over us taking their vital signs. Why? Physiologic integrity. We care about those vital signs before we care about what's going on up here. And guys, if you guys are kind of, on the fence about which patients come first, physiologic integrity, please be sure to watch my video on priority patients, because I clarify that for you. So I know you guys keep hearing me say physiologic integrity. If you guys don't understand what I mean by that, please be sure to watch that video. So you're going to take the patient's vital signs first. You got to make sure, and here's the thing, in the question they tell you that patient has a fever, diarrhea, they've been vomiting. So what are we worried about? Dehydration, right? We're worried about dehydration, fluid and electrolytes. So again, physiologic integrity, ding, ding, ding. Whenever you guys see anything that falls into the scope of physiologic integrity, that's your priority. That's who you're going to see first, okay? And this was a perfect example. Next question. Which nursing intervention is priority for the client diagnosed with anorexia who's admitted to the inpatient psychiatric unit? 1, obtain their weight. 2, assess the client's lab values. 3, discuss family issues and health concerns. Or 4, Teach the client about selective serotonin reuptake inhibitors, and I'll give you a moment to think of your answer. Okay, guys, if you chose number 2, you're correct. The lab values. Remember, guys, lab values such as potassium, sodium, glucose, that all falls under what? Physiologic integrity. Remember the list I gave you guys on physiologic integrity. Anything that falls on that list, that is what you're going to do first. That's the patient you're going to run to first, okay? So definitely the first thing you're going to do is check their lab values. That's number 1. Then right after that for the anorexic patient is going to be check their weight, okay? Checking the weight comes in second though. Next question. Which client should the psychiatric clinic nurse assess first? 1, a client with long-term alcoholism who wants to stop drinking. 2, a client who is a cocaine abuser and having chest discomfort. 3, client with OCD who won't quit washing his hands. Or 4, client who thinks she was giving a date rape drug and was raped last night. I'll give you a moment to think of your answer. And the correct answer, guys, is number 2. Remember what I told you about physiologic integrity, right? The heart, isn't that a vital organ, right? That patient having chest discomfort, we want to make sure they're not having a heart attack, they're not having an MI, they're not having any cardiovascular issues, because that will compromise their physiologic integrity. So that is the patient that you're going to go to first. Guys, I hope that you're starting to see a theme over and over and over again with these questions. And once you guys start getting it packed, you'll start reading these questions and you may not 100% know the diagnosis, but because you understand these concepts that I'm keep teaching you over and over again, you'll still be able to answer the question correctly. Let's move on to the next question. Clients diagnosed with schizophrenia is being seen by the psychiatric clinic nurse for the initial visit. Which intervention should the nurse implement first? 1, develop a trusting nurse-client relationship. 2, determine the client's knowledge of medication. 3, assess the client's support system. Or 4, allow the client to vent their feelings. And I'll give you a moment to answer that question. The correct answer, guys, is 1, to develop a trusting nurse-patient relationship. Because, guys, look at that patient's diagnosis, especially patients who are schizophrenic, right? So for the regular patient, you want to develop a trusting relationship with your patient, because without that, they're not going to, you're worried about them not telling you the truth. You're worried about being effective as a nurse, right? But especially when it comes to schizophrenic patients, because schizophrenic patients tend to be what? Very, very paranoid, right? So in order to be able to help this patient efficiently and for them to be able to verbalize their feelings and trust you with their feelings and thoughts, you have to have established that type of relationship. And so one of the important things that you can do to establish that relationship is to be honest and transparent, because patients can tell when you're lying. And something as simple as if they press the call bell and you say, I'll be there in 2 minutes, showing up in 2 minutes, okay? That's huge to them. That helps establish a trusting relationship, okay? And we're on our very last question. The clinical manager assigned the psychiatric nurse a client diagnosed with major depression who attempted suicide and is being discharged tomorrow. Which discharge instruction by the psychiatric nurse would warrant intervention by the clinical manager? 1, the nurse provides the client with phone numbers to call if needing assistance. 2, the nurse makes the client a follow-up appointment in the psychiatric clinic. 3, the nurse gives the client a prescription for a 1-month supply of antidepressants. Or 4, the nurse tells the client not to take any over-the-counter medications. And I'll give you a moment to think of your answer. Okay, so the answer of what would require further investigation or would warrant a follow-up is number 3. The nurse gives the client the prescription for a 1-month supply of antidepressants. Absolutely not, ladies and gentlemen. Let me tell you something. If a patient was in-house, inpatient psych unit, and now they're being discharged. So they seem to have been getting better. Now they're being discharged. The most that that patient can get is 1 week supply. That is the most. Because remember what you guys learned about these psych meds, right? Okay, they're very strong. So you give that patient a 1 month supply. What do you think is going to happen when they go home and the first thing go wrong? If they take that whole 1 month supply, they've killed themselves. Okay, the most that patient gets is a week. Really, you want to give 3 days because you want that patient to follow up with a psychiatrist, with a psychologist within 3 to 5 days of being discharged. But the most that patient can get is a week's worth. Then after that, they have to see their doctor, and that kind of forces them to follow up with the healthcare provider, so not only to get their meds, but for the healthcare provider to be able to assess them to see if that patient has any other needs. Guys, I hope this video was helpful to you. There's so much more that I want to cover because psych is so expansive. So I promise, I'm going to make more videos for you. But please, in the comment section, please comment on any concepts that either you're struggling with or you'd like to see me do a video about. Please, if you haven't done so already, press that like and subscribe button below. That's actually what keeps those videos and content coming. Thank you so much for joining me, and I hope to see you next time. Bye.